Hello everyone. We'll talk now about two topics, and by concluding those two topics, we'll be covering most of which functions related to outpatient area. The other functions related to the inpatient we'll be discussing, inshallah, when we reach the inpatient or activate the inpatient at hospital. So by now, all right, we'll go and see the clinical documentation. The clinical documentation here, all right, this function represents the medical forms like initial assessment or admission assessment or pre-operative, intraoperative, post-operative forms, and instead of documenting them, all right, as paper-based, here we mimic the medical forms or clinical forms and make them electronic, so doctors will be able to document electronically instead of the paper forms. For example, here, all right, we have Ludan initial physician assessment, all right, initial assessment. If I clicked here, all right, the system opens this form. All right, it takes a few seconds to load. All right, now it is coming. All right, this is the form. Here, all right, we can document it. We can, capture the needed data, all right, the date, all right, history of taken or history taken from the patient, for example, all right. We can say present complaints, duration, I can document here, okay, a few words or letters. Here, history of present illness, also I can document. Here we have review of systems, fever, dyspnea, what else? Palpitation, vomiting, fall or flank pain, joint. So I am writing here or capturing notes randomly. All right. So here we have checkboxes, TIA, transient ischemic attack, asthma. All right, I can write here as if I am using the paper-based form. All right, past history of blood product transfusion. Yes, no, okay, as per the need. All right, pediatric care. Okay, this is adult, for example. All right, the age is here. Okay, still pediatric, I don't know. All right, all these details for gynecology, obstetric, etc. All right, I can write them. Okay, I can capture also some vitals here, blood pressure. For example, here the pain scale, I can annotate. All right, etc. I can go through the full fields. Now we have the draft and the approve. If I approved, then the system, all right, documents the first version of this document, and everyone, all right, who has access into the EMR, electronic medical record, will be able to see what I have documented. If I made it as draft, no one can see what I have like written except me, because it's still on draft mode, and the system gives it version 0, created by administrator. This is the ID, all right, label, all right, of this document, all right, by what time, which date, all right. Now I can come, maybe finish some work or the pending work from my side, then I will press approve. Now I am publishing or releasing my document, all right. So everyone who has access into the patient's file will be able to see what I have documented, and the system gives it version number 1, as we see here. Okay. Still, I can do some amendments or modifications for certain fields. If I wrote here something and approved again, then the system, all right, will document it like version 1 and version 2. Here also we have the color legend. Green means approved, blue addendum or amendment or draft in this color. So if I come here, all right, okay, I will see, all right, the full documentation, all right. Remember this field, others, because the version 2 I have written some text here, all right. But when I go to version 2 here, okay, this one, okay, see the difference? This is the version 2, so the system keeps the track. Same way, I can, all right, more and more capture further history of present illness, for example, all right, here, or the presenting complaints. I would say Nidal Faraj, just to track it. Okay, I will come down, okay, and say amendment, all right. Now I have amended this document, then I would save. Then the system also gives me, all right, the track in this color, version 3, amendment or addendum, all right, in blue. Also, I might capture further details, all right. Same way, I can come down and also approve it, all right. Same way it goes in. We have version 4, etc., etc. Also, this is printable, okay. Therefore, I can export it into PDF, right, like this. When need be, I can print it out and deal with it or hand it over to the patient, if the patient needs a copy of this document, all right, still we can print out this one. Here we can scroll, all right, so we can have the full visibility of all the versions. All right, I hope you enjoyed the session. Thank you so much.